Oh, hey, let's talk about eating and drinking in labor. If you're pregnant, you might have heard that you are not allowed to eat or drink anything during your labor, or you might have heard that you are only allowed ice chips during labor. But where did that even come from? It came from this guy right here. This is Dr. Mendelson. And back in the 1940s, yes, 1940s, Dr. Mendelson, he did some research which said that if you are pregnant and you have your baby by caesarean section, and for that caesarean section you are put to sleep, you're under a general anesthetic, then you could vomit your stomach contents during surgery. Then that vomit could end up in your lungs, and that would cause major issues. And that is totally true, because your stomach contents, they are really, really acidic, right? They contain bile, and if you ate before your surgery, they are also going to contain food particles. Now, if that vomit goes into the lungs, that is known as aspiration. And aspiration, it is not only a pregnancy issue, it can happen if you are not pregnant and you have a surgery under general anesthetic. Now, Dr. Mendelson's research, it came around a time where more people were moving into hospital to have their babies, because in 1938, around 50% of people were having their babies in hospital, and by 1955, that number rose to around 90% of people having their babies in hospital. But I want you to remember Dr. Mendelson, because we are definitely going to come back to him later on in the video. With all of that said, this begs the question: has technology and science and medical practice not evolved at all since the 1940s? And if the answer to that question is yes, and spoiler alert, the answer to the question is yes, then why have the guidelines around eating and drinking in labor in the US also not changed to keep up with those advances? If we haven't met yet, my name is Tina. I am a labor and delivery nurse with my certification in perinatal nursing. If this type of content interests you, I would love for you to click that subscribe button so we can keep learning together. But before we get too far into this video, I want to clarify something. Here we are talking about eating and drinking in labor, where the expectation is that you are hopefully going to have a vaginal delivery. And if you have a C-section, it is because it is an emergency C-section that is not planned. We are not talking about eating and drinking before a planned C-section, because a 100% chance of having surgery, like if it was planned for your C-section, that is very different than the chance of surgery if you are hoping for a vaginal delivery. So if you are watching this video the night before your planned C-section, please do not stray from your eating and drinking guidelines that were told to you by your facility. Because if you show up the morning of your C-section and you tell them that you had an eggs and bacon breakfast, then your C-section is 100% going to be delayed until your stomach has time to process those foods and you are within those safe guidelines. We talked earlier in the video about a general anesthetic, but the truth is, in North America, most people are not put to sleep for their C-sections. Most people have them with something called a spinal anesthetic, and the two could not be more different. So a spinal anesthetic, that is a one-time needle that's used to deliver medication into the fluid around your spinal cord. Now, this medication could be local anesthetic and or pain medications. That just depends on your anesthesiologist, but they are able to obtain really complete pain control from about your nipples all the way down to your toes, where you are not feeling pain and pinching, but you are able to be awake for your surgery. And that is key, because when you're awake for your surgery, you are able to protect your own airway. And when your airway is protected, that is going to greatly drop those chances of aspiration. Now, if you were in labor and then you needed a C-section and you had an epidural running, that epidural could also be used to give you that complete pain control if you needed a C-section. You might now be wondering, Tina, you just told me that I can have a spinal and be awake when my baby is born, so why would I ever need to be put to sleep for my C-section? There are times where the spinal fails, it doesn't work, or you have an epidural that's working really well for labor, but it doesn't ever give you that complete pain control we need you to have for major surgery. There are also medical situations where a spinal or an epidural is not appropriate for you, or if your baby needs to come out right now because baby is in trouble or you are in trouble, there may not be time for a spinal, and at which point it will be converted over into a general anesthetic. Now, this is very different because the medications for the procedure are no longer going into your back by needle, they are now going into your intravenous. The doctor is going to give you a series of medications which are going to put you to sleep, but also paralyze your muscles. And that does sound scary, and it is, because it also paralyzes your breathing muscles. So the anesthesiologist has to then put in a breathing tube to help your lungs inflate and deflate, to oxygenate your body, and to protect your airway. So you can see how a general anesthetic puts you at an increased risk of vomiting up those stomach contents and them getting into your lungs because your airway is not protected by you. Now that we've looked at the anesthesia side of things, I really think it's important to look at some of these numbers because it's going to give you a better grasp on how many people are actually put to sleep for their caesarean births. So in 2020, there was a study published in the Journal of Anesthesia and Analgesia, and it studied around 28,000 people, and they came up with a number of 8% that are actually put to sleep for their caesarean births, which means that 92% of people were awake and alert for the birth of their baby, meaning they were able to protect their own airway, which is going to drop their chances of aspiration. And in another study, they found that it was 5 out of 100 people. So 5%, even less people going to sleep for their C-sections. I feel it's only fair that we look at his numbers as well, because his numbers have helped shape the guidelines on eating and drinking in labor that we still see here, now, and today. So his research, those 77 years ago, it looked at just over 44,000 people between the years of 1932 and 1945. And of those people that he studied who had a C-section under general anesthetic, 66 of them aspirated, which means the risk of aspiration is 0.15%. Now, of these 66 people that aspirated, sadly, 2 of them did pass away. They vomited up food contents in an unprotected airway during surgery. The American Society of Anesthesiologists, they have an official position on eating and drinking in labor. And in it, they talk about the fact that pregnant people are actually at an increased risk of aspiration simply because they are pregnant. And that is totally true. So when you're pregnant, the rate at which your stomach empties is actually slowed down when compared to somebody who is not pregnant, thanks to all those juicy circulating pregnancy hormones. Also, when you think of all the extra components you have in your midsection compared to somebody who does not have a baby on board, that makes a ton of extra pressure up against your stomach. So if you fill up your stomach, it's going to be a lot easier for you to puke those contents right back out. In this position, they also acknowledge the fact that aspiration deaths since Mendelson's research was published in 1946 have decreased drastically, but that major aspiration events still do occur. So here's what they recommend. They say we should steer clear of solid foods during labor, but that clear fluids, anything you can see through, should be encouraged. They also say if you are a high-risk pregnancy, like this chart right here, then maybe those fluids might be restricted, or the type of fluid or the amount of fluid that you might be able to have will change. They also do not make a recommendation on what you should eat and drink in early labor or during an induction, because there's not really a known amount of time that those segments are going to take. And if you have eaten something, that should not change your ability to get a spinal or an epidural when you're in labor. In this position, the AMA also talks about the fact that there's not a lot of research to support eating in labor. And oddly enough, that's true. There's not a ton of scientific research to support eating in labor. But if we think about it logically, the uterus is a muscle, and a super strong muscle at that. And if we are expecting this muscle to perform athletically for many, possibly many hours, wouldn't it make sense to fuel that muscle appropriately, just like we would fuel an athlete who is about to have a major caloric expenditure? I mean, maybe that's just me, but that makes sense in my head. The AMA also talks about the fact that restricting intake for a person in labor could have some undue stresses and some negative consequences, which I agree with as well. And they say that thirst sucks. Well, I mean, that's not how they put it in their position, but that is basically what they say, and I couldn't agree more. I mean, like, dry mouth sucks on a regular Tuesday, but when you are in labor, no thank you. They also go into the fact that being dehydrated can have some major health implications, so there is that to read into as well. If we were to expand our blinders worldwide, like to countries other than the US, we would see that some of them are changing the game in terms of eating and drinking in labor. And the one I want to talk about, because we have data from them, is the UK. So in 2007, the UK actually changed their clinical guidelines for low-risk laboring patients, and they now offer them a light meal and snacks and clear fluids in labor. And the data is pretty interesting. So they looked at maternal deaths, and they found 1 maternal death from obstetrical aspiration out of 6 million births. So here we are, 2023. Some places in some countries are now changing their guidelines to include eating and drinking in labor for low-risk patients. But there are still two big ones, these two guys right here, who are sticking to clear fluids only and not food in labor. So your best bet is going to be, if eating and drinking in labor is important to you, to talk to your provider and to talk to them early. They are definitely going to want to go over those risks of aspiration if you do need a C-section that turns into a general anesthetic. And that is actually great because you need to know the risks to be able to make a really good informed choice. Here's where you're like, Tina, I brought it up with my provider and I got a hard no. Or I took my snacks out at the hospital and the nurse told me that's against hospital policy. You can't have that. So what do I do? First off, if anybody tells you you can't eat in labor, that goes against their professional body, and that is not right. But here is what you can do. You can tell the person who is telling you not to eat that you have had an in-depth conversation with your provider and that you are aware of the risks and that you would like to eat in your labor. Now, that should be good enough and we can just carry on with your laboring process, but it may not be, at which point you could ask them, I'd like to see the hospital policy, and let me know if they bring you the hospital policy. If this is still not getting you where you want to be, you're going to be positive, but you're going to be firm. You're going to say, I'm aware of the risks and I am choosing to eat, at which point that staff member could chart, patient is aware of the risks and is choosing to eat anyway, and that should solve the problem. I do want to tell you though, that the staff member is not going to bring you food. If the orders say clear fluids only and you want to eat snacks, they are not going to go to the vending machine and purchase you some snacks. So you are on your own. Let's talk about what you could bring in your hospital bag if you are choosing to eat and drink in labor. Set your sights on carbohydrates. Think about like carb loading for a marathon, because that's essentially what you're doing here. And look for foods that give you a big punch of energy with a small surface area. The foods you do not want are ones that are super heavy, filling, or greasy, because we already know your stomach is emptying slower and there's that immense pressure on your stomach just from being pregnant. Now factor in those big, strong uterine contractions or repositioning or pushing your baby out. And if you fill your stomach to its absolute max in the battle between the uterus and the stomach, my friends, the uterus will always win, and there's a chance that you're going to end up puking your baby out while you push your baby out. So in your bag, pack things like bananas, nuts, seeds, nut butters, pretzels, crackers, dates are amazing, or you can always send your partner out for a smoothie if you prefer that. If you're going the clear fluids route, think about putting in honey sticks. They are sweet and refreshing, but they also give you energy. You can also pack in things like lollipops or Jolly Ranchers or gummy bears, ginger ale, you can do electrolyte solutions or vitamin waters, anything like that that's a little bit more exciting than what the hospital provides you, which is probably just going to be your straight up apple juice. Now, grab a snack and check out this video, because I bet if you enjoyed this one, you're going to also enjoy this one. Please feel free to subscribe to the community so we can keep learning together. Pop a thumbs up on this one, and I will see you in the next video. Bye.